Hello, my name is Luke Livingston. I'm a first-year medical student reporting on Mr. George Newman for my spring OSCE. So Mr. George Newman is a 55-year-old man, and his chief complaint is a sore throat that has lasted 3 months. For my HPI, I have Mr. George Newman is a 55-year-old male reporting to the clinic with a 3-month history of a left-sided sore throat that now radiates pain up to left ear. Patient also reports an unintentional weight loss of 20 pounds in the last 3 months. He states that the pain is dull and constant, but worsening, with it being a 3 out of 10 3 months ago and now a 6 out of 10. Nothing worsens it, and Mr. Newman has not tried anything to make it better. Mr. Newman thinks it might be drainage from his sinuses, but he denies having a recent or ongoing sinus infection. Mr. Newman and his wife are concerned that it might be cancer. For social history, Mr. Newman lives in a house in Hillcrest with his wife and no kids. His support system is his family and also a local Methodist church. Mr. Newman works at a bank and enjoys his job, not reporting any stress associated with work, and also insurance through work. Mr. Newman drinks between 2 and 4 beers a week, does not smoke, and does not use drugs. He reports getting 8 hours of sleep a night, a healthy diet with lots of vegetables and no fried foods, and walking 4 times a week, and low stress levels as well. For review of systems, for general, is positive for weight loss of 20 pounds in the last 3 months, no weight gain, HEENT, no ringing in ears, no vision disturbances, but positive for sore throat. Cardiovascular, no chest pain, no chest pressure, and no shortness of breath. For a physical exam, his vitals include temperature of 98.8, heart rate of 80, respiratory rate of 15, blood pressure of 119/75. On the HEENT exam, his head is normal cephalic, atraumatic. Eyes, he had clear conjunctiva. Pupils are equal, round, reactive to light and accommodation. Extraocular muscles, all those movements are intact. Ears, upon the Weber test, they're equal, bilateral. And the Rene test showed that air conduction was better than bone conduction bilaterally. His nose, his septum was midline and symmetrical. Upon the throat, he had multiple non-mobile, non-tender, enlarged cervical lymph nodes on his left side, and an enlarged purulent peritonsillar abscess on left side. On assessment, Mr. George Newman is a 55-year-old man reporting to the clinic with a 3-month history of worsening left-sided sore throat radiating up to left ear, and an unintentional weight loss of 20 pounds. Physical exam shows multiple non-mobile, non-tender, enlarged cervical lymph nodes on left and enlarged purulent peritonsillar abscess on left side. Given the patient's age, him being afebrile, unintentional weight loss, and the characteristics of the lymph nodes being non-tender and non-mobile, malignancy needs to be further investigated with a lymph node biopsy. A mycobacterial infection like tuberculosis could also be present, or could also present with this type of lymphadenopathy and weight loss, but it's less likely due to lack of respiratory symptoms or any skin lesions. For my plan, I'd like to do a lymph node biopsy to further investigate potential for malignancy, and then just an AFB test to rule out a TB infection or any mycobacterium infection. Thank you.